Okay, I'm going to test my sound. Okay.
Can you hear me okay?
Yes, Gina, I can hear you. And I don't think Dr. Nasser, Mark, are you on? That was, oh, I thought it was Gina. Is it Tamara?
That was me.
Okay, yep, I can hear you.
Okay.
Lisa, can you hear me?
I can.
Okay, perfect.
Okay.
Can you hear me? Okay.
Oh, got it. Got it. Got it. Mhm. Can you? Okay. So Haley is with Central District Health, and I think that Gina shared the link with her. The other ones listed for Lisa Roberts, I'm not sure about. And Dr. Nasser, are you connected? Hello, Dr. Nasser. Yeah.
Good afternoon, everyone. For those of you that I haven't had the pleasure to meet yet, I'm Kobe Dennis, Superintendent of the Boise Schools, and we appreciate all of you taking the time to join us today. Let me begin by thanking our panelists for agreeing to be a part of today. Dr. Mark Nasser, President of the St. Alphonsus Medical Group, Gina Pinnell, who is with Central District Health, and of course, our Central District Administration. We appreciate all the questions that have been submitted for today, but I can tell you there isn't going to be enough time to go through each question. Over 150 people responded with questions, some multiple questions per person. So we have put similar questions together so that we can get through as much information as possible in the time that we have together. Any questions that we don't get to this afternoon, we will be providing to building administration to reach out and answer personally. Before I turn this over to our Deputy Superintendent to moderate the discussion, I want to personally thank all of you for your grace and patience as we have navigated this pandemic. We know that it isn't easy, but we want you to know that we appreciate being on the same team with you. Although individual disagreements or misunderstandings are bound to happen in an organization our size, please know that the ability to talk through these issues is what makes our district strong and will carry us through the end of COVID. And that is our purpose today. With that being said, I will turn this over to Lisa Roberts, Deputy Superintendent.
Thanks, Kobe. I know that Kobe explained that we have grouped a lot of the questions together, and I will try and direct the question to the person who I think could answer it first, and then the other panelists can either agree, I mean, it can add on to it, or they could even pass. But for this portion with the medical questions, we do have Dr. Mark Nasser from St. Alphonsus, Gina Pinnell from Central District Health, and then Tamara Frederickson, who is our health services supervisor. So they'll be with us this first hour, and then in the second hour, administration will answer the next set of questions. So the first set of questions are grouped together around the idea of in-person learning. So I'm going to start with Gina, and I'm going to ask her if she can explain what enabled Ada County to move from category 3, which was red, to category 2, which is yellow.
Sure. Thank you, Lisa. Well, at a high level, I would say our community stepped up and we saw better compliance with some of the prevention measures that are asked of all of us at this point in time, which we understand are really challenging. But in July and August, the case rates and the number of cases we saw per week, per day, it doesn't matter what your measurement were, they to warrant the ability to be in person and do it safely. And so what we saw with the implementation of some of our public health order and the reduction of gathering sizes and the masking was a decrease in those cases to bring the overall transmission rate down. And that's what we are looking for when we look to the back to school framework. It puts the categories into 3, 1, 2, and 3 being no transmission to mild to moderate to substantial. And category 3 means substantial. And we are definitely shifting out of substantial, but still in the moderate phase, wanting to be in the mild to moderate phase. And so those numbers are looking good from our end. Of course, any improvement with smaller numbers is better, and we like to see that, but that was what enabled the category determination for Ada County and for Boise School District specifically.
Thank you. And Dr. Nasser, I know that the capacity at the hospitals and also number of patients in critical care plays into that. Would you like to speak to that a little bit?
Sure, I'd be happy to. So just as Gina had mentioned, as we're seeing this steady decline in the admitted patients over the last several weeks, that's consistent with the advancement to the next stage, next category, to be able to increase our local activities. I can speak for the St. Alphonsus experience. We're also in a collaborative between all the major health systems, and we're working together and speaking together regularly. But, you know, for instance, this week we're having approximately 20 patients admitted right now with COVID, and about half of those are in the intensive care unit. And that's approximately half of what it was just a few weeks ago. And so, you know, it's still a significant amount. I would say that if you look at the data from the very early stages, the initial spike we had in the March, you know, early timeframe, we're still above that, but we've been on a progressive decline in our admitted patients in the last several days that has been encouraging to have less critical patients in the hospital and more hospital capacity to be able to care for those who do need that type of care.
That's great. I might also add, so in addition to working with you, we've also done some work with Dr. Bramwell with St. Luke's, and we've also with Dr. Peterman with Primary Health. So Gina, so the COVID-19 numbers, and this is a specific question for one of our staff members, are in the hundreds each day, and the positivity rate is well over 5%. Please explain why it's considered safe to have students return to school buildings at this time.
Yeah, a great question. So I don't know when that question was submitted, but in our district, we are not seeing hundreds per day, which is maybe what they're seeing on the statewide reporting. So we look at an average case rate over a daily case rate over a 2-week period. And that's how we calculate what our level of transmission is. And we're seeing good numbers. As we mentioned, we'd like to see those decline. And so the positivity rate, it's something that we know our community has heard a lot about. It's really easy to wrap your head around that number. But one of the things from our health district perspective is we can't get that on a county level. We can only get it for our entire public health district. So positivity rate for Elmore County, Boise County, Ada County, and Valley County is not truly reflective of those targeted approaches and mitigations that we need to put in place. And so for our district numbers, we're around 5% now, which is great. But to use that as a specific measure for Ada County specifically is just not something we can calculate, or we have the data to do that. So we're looking at those case rates specifically, and that was in partnership with St. Alphonsus, with our family medicine doctors, with St. Al's, with the VA, really looking at what is that single measure, if we can create one, that tracks along with COVID admissions and sort of the rise in cases and the rise of concern, the decrease in testing capacity. What are those? And the case rates seem to be so far a happy medium, and so that's what we have determined to use at this time.
So the next question was the incident rate threshold number for the red category before the metrics were changed over Labor Day weekend. They're asking what that incident rate threshold was.
Yep, so I did calculate that. So they were asking for, I think we came out after Labor Day with a category 3 recommendation, and many people were hoping for the category 2 recommendation. And when we look back at those numbers, we did see we were in the range of the yellow category 2 at 17 point something. So we did meet that category 2 threshold. And it's one of the reasons why we wanted to move to a single metric versus the very complicated public health metrics that we had at the time. So we were under that threshold. I can share though too, you don't want to just inch by that threshold. You want to be well below that threshold. So if 20 is the cutoff and you're at 19 one Monday, or I would even say 18 or 17, that doesn't really leave a lot of room for additional cases. So we're still very confident about what we indicated, which is category 3. But if you're looking specifically at the numbers, we would have technically been in a category 2.
Okay, thank you. Dr. Nasser, did you have anything for those last couple of questions you'd like to add?
No, just that yes, I would just say that finding the right metrics and being able to track them so that we can make good decisions has really been the challenge, right? And so, just with our public health authorities and experts, trying to determine that, and really, my encouragement to you and to the team is to look at the trends over time for the metrics that we are looking at to help give us the indicator of which direction we're moving. There's probably no one perfect metric, but as we look at multiple ones and we try to triangulate and get an idea of what direction we're heading and what measures are working and what might put us at greater risk and how can we avoid that, that's really the way to go. And that's been the challenge, and I'm glad that we're able to now get in a more established framework of looking at metrics that describe the movement in the community. So,
I think I mentioned in an earlier board meeting that as educators, we all love a good rubric, and it's too bad we don't have a really nice solid rubric to follow for all of these decisions. So I'll start with you on this one, Dr. Nasser, and I'll ask each one of you this. Do you feel like school districts are listening to healthcare professionals like yourselves when it comes to the reopening plans and or the possibility that we could have to shut down again or go, full virtual if numbers do increase?
Thank you. I do. I feel like, I am honored to be a part of a collaborative between physicians amongst all the major health systems in the area. And we are all together, our endeavor, in fact, we met earlier today, and the whole purpose there is for us to get together, share the latest that we're learning from each of our individual systems so that as a community, we can best advise you, each of the school districts. We've been trying to advise some of the local leaders, some of the faith leaders, some of the just community leaders that are trying to all make the same decisions that we're making here. When is it safe to start to resume certain activities? So short answer is absolutely. We feel very much a part of the plan and able to, review the plans and help change and adjust them as needed as we go.
Great, thank you. Tamara?
I very much feel that not only have we listened and collaborated with health professionals in our community and Central District Health, but I also feel like we've called on our own health professionals in the district, as evidenced by the group of nurses that we pulled together pretty early on in late March to look at national research and trends and help develop some of our guidance that we have for some of the procedures today.
That's great. Thank you. Gina?
Yes, absolutely. And you know, there's this theory in change management. You have to hear something 7 times in 7 different ways. And I don't think this fits any differently. It takes time to fully comprehend this massive modification that we all are having to make in our personal lives and our work lives and in school settings. And so I think that the district has been very adaptable and nimble, and that's been along the way. I think if we could all make a change automatically, it would have been best. At the same time, it's just not reasonable to expect. And so the district's been involved with direct consultation with us and local public health since the get-go, since early March, knowing that I think the hope to reopen and then understanding that that might not happen, how to plan for safe reopenings for the fall.
Right. So we'll continue with you. So if we go back to red, and I know this question will also come up for administration later, but if we do go back to the category 3 or red area, would you recommend the district go back to online learning only?
It's a really tough question. The back to school framework says yes. That was developed, you know, in June with academic professionals and me as one of the only public health professionals at the table. So I don't want to give a hard no that you couldn't return to in-person. We just, there's an assumption, and maybe it's an accurate one, that schools will be a driver of transmission. And we just don't quite know that yet. I can say if the option exists for schools to remain in some type of in-person, whether that's 1 day a week, 2 day a week, very hybrid, you know, I'm not sure what that could look like in a red, and transmission rates aren't increasing as a result of schools. I think the option exists to open for some in-person learning in a category 3. Now, if we, as we have seen with some schools who did open in a category 3, if transmission rates are so high in the community, those cases are going to come into your school and it's going to be really hard to manage them. And so I think that the option is there, but what will be that recommendation at that point in time? I don't know. It depends on if the category 3 comes, you know, November 3rd, it may be more remote. If we get some time and some experience under our belt of how we operationalize the classroom and the cafeterias and the drop-offs, how we respond to positive cases, and we're able to identify and, you know, quarantine the individuals who are exposed. And if that's done successfully, I think the opportunity exists for some in-person learning in category 3.
Dr. Nasser, do you have an opinion on that?
I do. I think that we're starting to see anecdotally in the health systems some transmission that's related through students, but thankfully it's been at the lower levels so far. So I think what our concern is, and certainly the measures that the schools have been taking as part of their operational plan seem to be making a difference. So at other parts of the state and in some studies that we're seeing from some other schools, perhaps out of the state or, you know, in other areas that have tried to open, trying different techniques to mitigate risk. For those that have not been trying as hard, we've had some reports of higher rates of transmission. And here in our county and in our local schools that have started to open, what we have seen is small numbers that seem to be associated. But again, at this point, we haven't seen significant school-related spread, and that's great news. And I think that's a testament to all the efforts that have been underway to try to bring students back and teachers back safely.
Right. Tamara, I'm going to start with you on the next question. This staff member asks, do you feel like the Treasure Valley is ready for all students to return in person before the spring semester?
I absolutely do, just because of the research we've done, the lessons we've learned from other areas, and from some of the activities we've already engaged in. Will it be all students all together every day of the week? Potentially not by this spring semester, but again, with our phased in plan, I'm confident that we can bring students back at least some of the time in some sort of manner.
Great. Thank you, Gina.
I would echo what Tamara said. It's going to be determined on how this rolls out and how things are handled and managed and how plans are sharpened over the course of a few months. I think because social distancing and physical distancing is one of the best and most effective ways to reduce transmission, for some student populations, whether that's older populations or younger, where it's yet to be determined, it might not happen that the 5-day-a-week in person is sustainable. We just don't know. I think the cohorting for younger groups, which we'll probably talk about a little bit later, is certainly an option and has been successful in other schools locally as well as across the world and other nations. And so I think that that option, you know, we don't want to take it off the table, but I don't want to set an unrealistic expectation that we could be in this very hybrid model for the rest of the school year. As not the worst case scenario, I would say worst case scenario is we're all remote online the entire time. I don't think any parent or any community member wants that, since that education is suboptimal, especially for younger kiddos. So being very nimble and adapting our plans and looking at which populations can benefit most from in-person will be really critical.
Great. Dr. Nasser.
Yeah, I agree. I say, let's see how we go. Let's be adaptable and nimble. Let's see what the community, you know, rates are, and that's going to drive a lot of the reflection of what would happen in the community. Will drive what probably would be happening in the schools. Let's see what our mitigation efforts are to date. And I think I'm very optimistic that as we learn more, we continue toward better treatment, continue toward better vaccines. You know, there's a lot of movement between now and the spring, and if you think about how much we've already learned with this novel virus, I think we're going the right direction. And just with the flexibility to not commit to something 6 months from now, that it would be hard to say exactly what we can do, but we'll have that direction and stay flexible.
Okay, thank you. The next question, so, you know, we've created this slow phased in approach where we're bringing K2 back, then 3-6, and then we will be bringing back our secondary schools with the goal, and this would be a goal of all of our students being together 2 weeks prior to Thanksgiving break. So I think there's concern with this question is with students traveling and gathering for family members, do you think it's wise for us to try for all students back 2 weeks prior to Thanksgiving break? And we can start with you, Dr. Nasser.
Yeah, I think a lot will depend on, you know, what we learn as you start to phase in, and if you start to see significant positives either in single students or in cohorts of students, we might have to adjust that plan. I think the wise thing to do is just going to be to take it one step at a time, and again, you know, to be flexible enough to be able to adjust. The risk goes up anytime you gather in large numbers in a small space. And so even as we return to all students coming back in, anything we can do to, you know, to maintain those risk mitigations that are part of the plan. The plans are very good. I think the key is going to be in how do we execute the plan, you know, how do we move forward on the plan? And that's going to be this time now to see. So we'll have to see. You know, there was big concern about Labor Day, which we just had, and we're still watching to see if there was an effect from that. You know, we knew families are gathering, and this is another great example of that. All the holidays coming up, it's going to be a similar situation where we're going to watch and see what people do either at work, at school, or at home.
Thank you. Tamara?
I would just add to that, the other factors that we don't know until we get there, and we'll again have to adjust and be nimble, are we don't know what this virus will do as we change seasons and as people are indoors more, and that sort of those sort of factors. And so it very much will be a case where we just have to adjust to the situation of what is going on with our case rates at the time.
Okay. And Gina?
Yeah, I think the phased in approach, starting with the younger populations first, is the wisest, given the learning modalities that need to happen and the level of, you know, one-on-one instruction or personal instruction, and just the suboptimal use of electronics or remote learning for kids. And based on, you know, what Dr. Nasser and Tamara said, absolutely, we may not get there, and it might be too much. But at the same point in time, I don't think the holiday, we can give lots of reasons for why this isn't going to work, but we can anticipate those and communicate to our families and to our community that these holidays should and need to look different than they have in previous years. And I can say that one of the things that we think is a big motivator for cases going down is the fact that students are not in person. I've seen a lot of behavior change as a result of that. You know, it was a lot of talk, and people think that maybe they thought it wouldn't happen to us, and here we are. And so to know that to keep students in school in person requires significant modifications to our vacation planning and holiday planning is one thing that we can push and message, and it might help. And so I think the goal again is that 5-day in person if it's doable, but again, to remain flexible as we move through to assess weekly as we can to what the transmission is happening or isn't happening and make decisions based on that.
And I guess from the district standpoint too, I would add that we are 100% committed to being flexible in that and to continuing to listen to all of you before we do make those decisions, you know, between phases. Gina, the next question is specifically for you. It talks about sports teams being allowed to practice when students aren't in school. And did this advice come from Central District Health?
Yes, this is a very complicated issue. And the reason it's complicated is if you go back to phase 1 of the governor's reopening plan, that allowed for youth sports and activities. And so in Ada County, we're technically in a public health order phase 3 of the governor's rebound stages. And so that allows for youth sports, and schools fit in that category of youth sports. And so what has happened is you now have a phase plan plus a category plus a back to school reopening plan. And we can't extract just schools at this point in time from our public health order. And so we have created a youth position statement on what we think is what is our recommendation based on what category you are in, and that is up on our website. And so part of the justification was certainly getting youth out and getting some physical activity and being engaged when protocols could be followed, when safety procedures were in place and could be enforced. And schools have the ability to do that. So that's one plug. On the opposite side is we are seeing transmission as a result of sports and school sports specifically. And so it remains a concern to us and to our schools and to our community on how this will be addressed moving forward, especially when we look to sports being moved indoors. And there might be some tough decisions that need to be made. I hope that's not the case, but it might come down to, do we allow this or in-person learning? What are the impacts of both? And I don't know that we'll get there, like I mentioned, but we are already seeing it, and we're doing outdoor sports now. So we anticipate that it will probably remain an issue because sports are intended to be a close contact for many of them. And in our, I will say in our position statement, we do outline specific sports and separate them. Like if you're in a cross country meet and you can physically distance and have different start times, that's very different than if you're in a high contact sport. So we're trying to be as flexible as possible. So the advice did come from us, but it is quite complicated based on trying to manage those 3 different buckets of guidance documents.
Thank you. So the next set of questions all revolved around, so we have a district level pandemic plan. And you know, all of our and our schools have those plans as well. We have a phased return to in-person learning plan. And then of course we have a face coverings procedure. So the questions here are, have you reviewed these plans? Do you support them? And are there any concerns about the plans that we've submitted? And Gina, since we're with you, we'll start with you and then we'll move through the other panelists.
Yes, I have reviewed these plans many times and I support them. I was able to see the memo about face coverings, and so I also support that. That worked in collaboration with us as well, with some caveats for face shields when necessary, but certainly not our first recommendation, but wanting to account for some learning needs that might happen at the younger levels. But I think the district, and I reiterated this earlier, has been very flexible and willing to adapt. And so, yes, from our perspective, we support the plans that are in place.
Dr. Nasser?
Yes, absolutely. Had the honor of working with the school district for the early part of the plans, development of the plans, and then watched as we've moved forward over the last weeks and months to, I would describe, a strengthening of the plans. They're very thoughtful, very detailed. I think becoming more robust, really considering more guidance as more guidance has become available. So I think they're great plans. I think the challenge, as I mentioned, is going to be how do we move forward with the plan and really get that feedback loop in when we start to get together and we have a positive case and we follow up, and how do we manage that? And so any concerns I have is just going to be, you know, as a community, as we move forward, for us to stay flexible enough to be able to adjust our plans, share information, and then move forward together to be as safe as possible. But I definitely feel good and confident of all the thoughtful effort that has gone into the Boise School District plan.
Thank you. Tamara?
Yes, and I would just add to that how impressed I have been in working with the district in developing these plans, and the amount of professionals, whether it be in the community or our own professionals that you have involved, committees that have been formed, input that you've sought, and again, other countries, what they've done, or you've looked at. I feel like the district has looked at everything, and so I feel very confident with the plans.
Great, thank you. So the next topic is the hot topic, it seems like ever since probably May, really, and it's face coverings. So the first question is, and we will start with you, Dr. Nasser, what are the adverse effects of wearing a mask for 8 continuous hours per day? Do we need to be bringing multiple masks to school each day and switching those out?
Yeah, thanks for the question. So we've received this question a lot in a variety of different ways. I would just say broadly, from if you look at the preponderance of the advice and medical information that's held to by most authorities and health systems and most of those out there that are trying to really lead on this, and from a public health standpoint as well, is that there's no clear evidence of harm from wearing a face covering or mask. Either one, like I'm wearing a surgical mask or a cloth mask that many of you are wearing, even on this. It certainly can be uncomfortable in the heat, and it certainly can be something new and different. But as far as adverse effects, we certainly don't want to cause harm. So the first, principle of medicine is do no harm. And so the intent of the mask is to actually mitigate risk, as you all know, prevent the spread, prevent the chance of transmission of the virus. And it seems to be fairly effective in doing that. The mask, in essence, the face covering, in essence, creates distance. So for something that's spread by droplet precautions, if we could all stand 10 feet apart all the time, or 20 feet apart, even better, but even 6 feet apart is probably as safe as you want to. But by putting the mask on, it allows us to safely interact with each other, even in a closer environment without, being at risk. So certainly can be new and different. Sometimes, depending on the weather, it can be hot. If it becomes soiled or wet, probably a great idea to swap it out. If teachers or students have multiple ones available, that's probably great. Washing them frequently if they're cloth is a great idea. Replacing them so that you can have something fresh is a good idea. But I would, as far as having to swap them, that would really depend on, comfort and need, depending on how you're doing throughout the day. So, thanks.
Gina, and then Tamara, do you have anything to add to?
Yeah, I would just say that there's no evidence that there's any health risk to wearing a mask for 8 hours a day. Medical professionals have done it for years in much severe circumstances, wearing something more than a cloth face covering. So whatever you can do to increase compliance with students, if that means they need to change one every hour because it's fashionable, that's great. If they want to wear the same one every day, like my daughter, then I need to wash it every day. So whatever the individual works best for them and their families, we would certainly recommend. I had also had a question, which I will chime in here because it was a recent one from a school about, should we spray the masks with sanitizer to clean them in between periods? And so there's a lot of things that are a result of the mask wearing. So we certainly wouldn't recommend that. You shouldn't inhale alcohol, and that would be put on the mask at that point. But one mask a day would be fine for those who want. And then for those who want more than that, I think that's also okay to accommodate to that need if that increases the compliance.
Tamara?
And I would just add, Lisa, that I think this comes from some people. There's a belief out there that by wearing masks, you're increasing your exposure to carbon dioxide that you're exhaling, and that can be dangerous. And again, back to Dr. Nasser's point, there's no evidence to corroborate that. So again, masks can only improve our safety in this pandemic.
So because we're already 2 or 3 minutes in, and we are still on the first page of questions, I'm going to skip a few and we'll come back to them if we have a chance, because this is a really good question. What extra precautions can I take while working with a student who does not wear a mask due to a medical exemption? So this teacher is wanting to protect themselves if the student isn't wearing a mask. Tamara, did you?
Sure.
Start?
The best protection we can take is to wear masks ourselves. So as many adults and other people, individuals in the room, if we can wear masks or some sort of face covering and implement the physical distancing, and then of course the good hand hygiene, all of that will just improve our chances of reducing transmission.
Gina, anything to add there?
No, she covered it. The only thing I guess I would add, thinking about proximity and duration, is that 6 feet, but also limiting the time that you're in close contact with that individual. So if you can teach from afar, or if you need to approach that student in particular and do short interventions, that you just try to limit that close contact when possible. And one addition, if people really are concerned, is wearing a cloth face covering and a face shield. So both of those would add a little bit extra protection for them as well.
Okay. Dr. Nasser.
I think it's well said. I think distance, I think a cloth covering or a covering of the nose and mouth is helpful for the teacher and for the student. So if not both, for one is better than none. I did want to make a quick comment on the face shield. So the face shield is helpful, if you will, in some aspects from maybe droplets, arriving or landing on the face, but it's not as effective as something that covers the nose and mouth. And so I think in some situations it's thought of as an equally effective substitute, and it is better than no shield, just like maybe a plexiglass is better than nothing. If you're talking to somebody or you've seen a lot of these sorts of shields, barriers, if you will. And there's some situations where it allows you to be able to see the face or articulate better. Certainly it's not easy to always talk through certain types of these masks. But Gina said it best. So if you're wearing a mask and a shield, which we do in our in clinic, that's what we wear. We wear eye covering or a shield and a mask for that extra level of protection. And it really seems to be effective. We're not seeing significant transmission between patients and healthcare providers at any significant level with that level of protection. And so the addition of that would be very helpful. But ideally, as far as for you transmitting out, a face covering is going to be better than a shield, because unless it's a very, very comprehensive shield, if it's open on the sides, then it's not going to be as effective as a mask. So better than nothing, but not as good as the mask. So there may be some other thoughts or questions or comments on that.
Well, so then there are several questions about like sports, running and exercising, and recess. So should students be wearing masks outside during those things? Dr. Nasser?
Yeah, I would just say if you're outside and the breeze is blowing and you're 6 feet or more away from the other athlete or other student, the risk starts to drop tremendously. And if students are outside, especially if they're running or if you're out, sports practice, cross country is a great example. You're out running on a trail and you've got a little bit of distance. There probably is not a lot of benefit to wearing a mask, and that would be a situation where you may not need it. You certainly could, but those are sorts of situations where the risk would be much lower. So when students start to congregate in smaller spaces, and as they're indoors in smaller spaces, especially if there's going to be heavier breathing, that sort of thing, then that becomes even more important to wear a mask. So I think Gina had mentioned, depending on the type of sport or the type of exercise, the risk certainly can vary and go up and down. But generally running outside apart from somebody else is going to be pretty low risk activity.
Okay, thank you. I'm going to move on to COVID-19 testing, because I know that testing and quarantining or cases being identified are hot topics. So COVID-19 testing, Gina, what is the availability of testing supplies and the likely turnaround time for testing?
Sure. So that answer today will be different than it was 2 weeks ago. So it depends on the level of community spread and transmission that we're seeing. Right now, it's pretty quick as far as a turnaround, and testing is available for those who have symptoms, and even some for asymptomatic who might have been identified as a close contact. So if you have those scenarios, you're usually able to get a test. Turnaround times can be, if you have, a certain machine, they can do the rapid test. So it's 15 to 20 minutes to get that. Or a turnaround with the lab can take, 2 to 3 to 5 days. It really just depends on which lab, if it's sent out of state, et cetera. So there are other there's ways to understand who locally has a lab that's a quicker turnaround time. And we certainly recommend that in this case of teachers to try to access those that have a quicker turnaround time. It's not an out-of-state lab that we have to wait for the result. And so it is going to depend on the level of community spread. And I know we are involved in testing sort of, as far as we're on the periphery, but we really come in for the planning and the response for an exposure. And so we don't offer testing at the health department, and we rely on our healthcare partners to do that. And so we look to the testing task force and to them to probably better answer this question.
Dr. Nasser?
Sure. The testing has significantly improved since we've last met as a group here. I think Gina summarized it well. So we have multiple different ways you can test in our system, and I think it's similar across most of the systems. But at St. Alphonsus, you come to our testing site, we now have the rapid test available, so you can have the result, before you even leave the site. If it does need to be sent away for the standard viral PCR test that we've been sending either to the in-state lab or the out-of-state lab, it's coming back anywhere between 3 and 5 days, 2 to 5 days, just exactly as Gina said. And then for those patients admitted to the hospital, we have the ability to run a test right in the hospital and get those results back, within the same day or the next day. So really a few varieties. So if there's a concern, we now have more rapid options than we did even 2-4 weeks ago. And that's encouraging for folks to be able to get the results and then have that information available.
Thank you. So the next questions are about educators or students. Do you know of any preferential testing priority for educators or students? And is it beneficial for non-symptomatic testing for students and staff? We'll start with you, Dr. Nasser.
Yeah, certainly we take all who need to be tested and are happy to test them and want to take care of them. The asymptomatic with no significant risk. Just to get a test just to know, or get a test to travel or return to work, we haven't quite gotten back into testing all comers just by choice yet because of the limitations we've had to date. I think many are eager to get back into more broad testing, and we're included in that. And the state is also trying to move toward mass testing capability, and we're in a collaboration with others across the state to try to, get that moving forward. But at this point, we're still testing those who have an indication to be tested until we have a more robust capability to test for more broader indications. So, but a teacher or a student who has an indication, an exposure or symptoms, certainly be happy to take care of all of those.
So I'm going to wrap that into the next, into another question, Gina, if you had anything else to add with this last one, but then can we mandate that a family be tested?
No, no, we can't. And that's okay. One of the things we look for if there's an exposure or close contact in a family unit and they're not able to isolate, is we just assume that person is a close contact and exposed, and they follow those quarantine guidelines. And so capacity as far as testing is important, but we follow the symptom-based return, which is if you have symptoms, the 10 days from the symptom onset, plus 24 hours fever-free, and then no other symptoms. And if you are asymptomatic and receive a test because you are a close contact, then it's 14 days from that date of test. So having a negative test is really not a good indication even to come back and to require it. And that also goes along the lines because there's some evidence out there that there's a lot of false negatives. So if you test too early because you were exposed, you will have some false sense of security that you do not have COVID when you just haven't actually developed the symptoms enough to show a positive result. And so we don't put that as a requirement and don't recommend schools put that as a requirement for safely returning.
Thank you. Tamara, if a student returns to class and they refuse to take those appropriate measures and they ignore the health and safety protocols, how can we best prepare to still maintain the safety and health of other students and ourselves? So if you have that student who's being defiant about those things, what as a school can we do?
So good question, Lisa. I would say, again, it goes back to those basic safety factors that we talked about earlier with masking all the individuals that we can mask or use face coverings, implementing good physical distancing, and perhaps implementing some more of the virtual strategies for students in situations, again, to increase that physical distancing as appropriate.
That's great. Thank you.
I would,
go
I
ahead.
would also add that we do have compiled, if staff are interested, we have compiled a list of agencies across the Treasure Valley, healthcare systems and different entities that are doing the COVID testing. And in that list, there are a few agencies that are doing the asymptomatic testing if individuals are interested or need
Oh,
that.
perfect. Thank you. And I did know about this. I really appreciate you adding that.
Lisa, can I chime
yeah.
in real quick?
Yeah,
Just
you
as-
bet.
So one of the things that I think would be valuable with the sort of the compliance and the expectation and the hope that people follow these prevention measures is, I know each of your individual schools have values, or I think of, and I'll use Pierce Park, Panther Pride, I think of two offhand, kindness and responsibility. These prevention measures can be tied to those and be an expectation of how you are kind and responsible community citizen, not only for your individual school community, but your general community. So leveraging those as much as you're able, being patient and using the education component to up to a point we understand. And we also have had schools, and I don't know where, I kind of know where Boise School District is headed, but who have just said, if you cannot and will not follow these prevention measures, then you can go to online school at this time, just because of the safety risk that it poses to everybody else. So I wanted to throw those two things out there real quick.
And Gina, that's a great point. And you're exactly right. So when we have students who are defiant, we have, specific procedures that we go through with discipline. And so that we would expect that would happen as well, when students come back in. Okay, I'm going to go ahead and move on in the interest of time, because I know that this one is really on a lot of people's minds. And I'm going to start with you, Tamara, because it's about positive cases identified in the school. So how does the contact tracing work in quarantining, and how does that start with the school level? And then we'll let Gina and Dr. Nasser kind of talk from there.
Yeah, again, it goes back to our great collaborative relationship that we have with our healthcare providers and Central District Health in our area. But when we learn of a positive COVID result, the school nurse then will reach out to that employee or that family of the student to learn the details of where they were tested, when they became symptomatic, that information that Central District Health is going to need for their contact tracing. Then we report it to Central District Health as required by our district policy, and Central District Health does the contact tracing. And we then follow their guidance on quarantining and isolating individuals as needed.
So Gina?
Sure. So Tamara's exactly right. One of the things that we do once we get the information about the positive student or staff member is looking at the investigation piece and really drilling down from, if it's a staff member, certainly we can go to them. If it's a parent of a student, sometimes they can help with that information, but we really look to the school to help us understand what that daily life looked like for the student. Did they come on a bus? Were they dropped off? What is their classroom? Is there physical distancing in place? And we're looking for close contacts, and that's defined by proximity and duration. Anyone who is within 6 feet for more than 15 minutes. And throughout the school day, during the period where they were infectious and on school, in this scenario, on the school campus, those individuals would be asked to quarantine. So in the example of a cohorted classroom, and I'll use a kindergartner classroom, for example, if you have small groups of 3 or 4 in different sides of the classroom, and those individuals maintain social distance, physical distance of 6 feet throughout the day, and let's say they eat together and then they play on the playground together, if there's an infectious person in the classroom, then only the individuals in that close pod or cohort will be asked to quarantine, versus if you don't practice physical distancing and it's just an intermingling and there's kind of an unknown exposure risk, we will recommend that the entire classroom quarantine for 14 days. And the exposure to those students could potentially lead to an actual infection. And so it will look a little bit different, but then we monitor those individuals who are identified as close contacts by calling them frequently to check on if they have symptoms, to see if anyone in their family is developing symptoms, and to make sure that everyone in this sort of circle is aware of when it's safe for them to return based on that 10-day if they have symptoms, or the 14-day quarantine from the last time that they were exposed to that individual. So I think Tamara's been great working with us and the school nurses and getting us the information, and we try to respond, and we're able to respond a lot quicker now than we were maybe during August and July when we were having some cases in sports. It took some time to get a response. But with the cases low, we're able to offer that support quickly so everyone can quarantine and keep the rest of the school community safe.
Great. Dr. Nasser, do you have anything to add?
Oh, yeah, that was a great summary. Thank you.
Okay. So since we're with you, Dr. Nasser, I'll have you start here. So if anyone in our household has COVID symptoms, this person says, I understand they are to not attend work or school, but what about the rest of the family? Can I go to work if my child wakes up with a fever? Can my child go to school if I'm experiencing symptoms?
Yeah, that's a great question. So it really depends on the closeness. If certainly two members of a close household, like maybe spouses or a mother and child, maybe in this situation where there's going to be lots of interaction, you would want to take some extra precautions. If the adult had an exposure at home, it would be reasonable to try to stay home and see if symptoms develop. If they could go to work and they could keep physical distance and mask and monitor their temperature is what we would recommend, at least a couple times a day is what we do. If there's been an exposure, but an asymptomatic worker, even in a healthcare setting, sometimes we won't necessarily prevent them from coming to work, but we will very closely monitor them for the development of any symptoms. And then again, depending on the level of risk and exposure, that might be an indication to get a test and see if it was true exposure. So now, if both family members have symptoms and there's a positive test, absolutely, sick symptoms, you need to be staying home and not exposing any others. So.
Okay, thank you. I'm going to move on to other safety measures. I know that this is an area too that there's lots of questions. I'm going to start with Gina because I know the answer to this. How important is social distancing?
It is the most important thing you can do, especially when that's the level of exposure. When we're looking at a close contact, it's the 6 feet, and that's masked or not masked. And I'll make that clear that if you are 6 feet and within the time frame of 15 minutes with someone, that's when we will say that the exposure did not happen and you don't need to quarantine. If you're 3 feet and a mask or without a mask, it won't matter. You will be asked to self-quarantine. So physical distancing is critically important throughout the school, and probably the most hardest to implement. I know masking is the most controversial, but physical distancing is the probably more challenging one to actually implement in the physical spaces that are provided. And that's why we do look again for the smaller, younger elementary kids at that cohorting, because we've had daycares do this, summer camps do this, and they're able to do it successfully. So there are ways that you can manage. You don't have to envision elementary kids 6 feet apart in individual desks all day long. It can look a little bit different as long as you're keeping those core cohorts or pods or bubbles consistent and apart from each other.
Great, thank you. Dr. Nasser, what is the best knowledge we have right now about how the virus is transmitted concerning children?
So we know the virus seems to be transmitted through droplet spread. So coughing, sneezing, touching of the face, and touching something and maybe touching one's face. The way it's transmitted through children is we believe it to be the same as the way it's transmitted through adults. And thankfully, most children who have contracted COVID have a relatively stable or a course of the disease in such that they are able to recover well. Not all, though. We have had some significant disease in young children. And in rare cases, there's a multi-system inflammatory response in children where it's a quite severe case. There's been some local cases where children had to be hospitalized and receive intensive care, level treatment. So the good news is, for the most part, even though it is transmitted in children, it seems to be something that is not severe in most children, as it is not severe in most adults. But I think it's important to know that we have seen transmission in children and across families through the children. That when it's traced out, I think Gina and her team can probably speak to that even more so, but it's important to know that that does happen, and that's why we're taking all these precautions to mitigate risk.
Gina, did you want to add to that?
Yeah, he did a great job summarizing. The only thing I guess would be the recent research and studies out there that show that children actually carry a even a higher viral load than some serious ICU patients, but they don't show this. They're asymptomatic, and so that's good in the sense that they're not coughing and sneezing on every other person that they're running into, but they do carry the viral load that can spread. So that is why masking is really important and physical distancing, like we mentioned. So it's fairly new. And again, the sample size wasn't that great. And we're cautious in sharing information one way or the other because people will take it and run with it. But we think it's really important for people to understand that kids do have this and they are contagious. And luckily they're more asymptomatic, so to speak. And then at the same time, their severity of disease is less than the at-risk population or the older generation. So those are the things that I would add.
Thank you. Tamara, I know that you spoke to this earlier today, so I'm going to ask you, what are your suggestions for keeping family members safe when I leave work and return home? So especially if, you have a family member who's has a medical condition, and as a teacher, you're going to work each day and then coming back home. What suggestions do you have there?
Yeah, I would, and I feel like I'm a broken record, but again, the physical distancing, mask use, and good hand hygiene in and out of school. I think often what we've seen is people do a really good job of implementing these strategies at work, and then maybe in their personal life they relax a little bit, forget to wash their hands as often, or maybe ride in a car with another person, and so they've limited that physical distance, and that puts them at risk in certain situations. The other strategy that I would recommend, it's just a suggestion, they wouldn't have to do it, but you could look at changing clothes when you get home for the day and putting a different article of clothing on than you wore to work, and then washing that clothing every day, just in case it has viral load on it.
Great, thank you. I am going to start with Dr. Nasser on this next one. So lots of questions around handling of materials. So textbooks, laptops, paperwork. Do teachers need to quarantine paperwork when it comes into them? I mean, what are your thoughts on those different surfaces that students will be touching?
Yes, I think there's been quite a bit of varied publications on this topic of how long does COVID survive on different surfaces. I think that started out early on. As we progressed through the pandemic to date, I think we've seen it ranging from minutes all the way to several hours to days that you had to quarantine items. Where we've settled on this from a hospital standpoint and a clinic standpoint is not so much that we quarantine sheets of paper, but that we wash our hands, we disinfect high-touch items. So if we're sharing an object, like disinfecting a pen that might be passed between people, doorknobs, or different parts of the classroom, or just different parts of the clinic, and we try not to touch our face, and by doing those measures, you're probably going to minimize picking up a virus, not just COVID, but any of the multiple other viruses that are out in the cold and flu season, and not self-inoculating into the eyes and nose, and mouth by rubbing your eyes or scratching your nose with your hands that you might have come in contact with. So that's what I would recommend, would be those measures. And I think part of the plan includes a disinfecting of the rooms and the high-touch areas in our clinics. I think part of the school plan includes something similar. And you can't go wrong by, if you notice some things being passed or high touch between students, and by doing some extra cleaning in the classroom. But those are going to be between the behavioral, not touching face and washing hands, and then the cleaning of the rooms. I think we're going to be able to get a handle on the surfaces, if you will, the objects.
Great, thank you. Tamara, do you have anything to add?
Yeah, I would just add, Lisa, that I think it's important. This is a really stressful and busy time for us as educators. And I think it's important for us not to forget good self-care and what that can do to our immune system. So getting good sleep, having good nutrition, and having good self-care that reduces stress management. I think those are all super important as well, and we shouldn't forget about those.
Gina, anything to add there?
Just that person-to-person contact is how this virus spreads most. So those things are important, the hand hygiene and disinfecting. Keep those up to par, keep them routine, but focus on the social distancing. I just don't want those to distract away from other efforts, because we can get into the weeds sometimes about what ifs and all these things, and they are important. I don't want to discount them, but let's focus our energy on the things that we know where the transmission happens the most, and those are the physical distancing components.
Gina, should there be concern around sharing public bathroom space with COVID exposure? And then we've heard some rumblings about air dryers in our bathrooms.
Yeah, those are great questions. So I don't think anyone's washing their hands for 15 minutes. And if they do, you can you can redirect them. But those are going to be intermittent exposures, quick 20 seconds, 30, 15 more seconds to dry. I think where you want to look for the bathroom concerns is lines, congregating, waiting, to get in, making sure the capacity, like you have a number of people who can be in there at a certain point of time and not letting people just flood through there. But those are short periods of time, just like hallway passing. It's not a huge area of concern for us. No, it's a myth that, air dryers can, yes, airflow can impact where COVID goes and flows, but please wash and dry your hands, whether that's with an air dryer or paper towels. There's no evidence to say that it's riskier to do so.
Okay. So Dr. Nasser, can you speak a little bit more about the air circulation with COVID-19? I know we've got, some of our newer buildings don't have windows that open, and how that, is there anything that we should be doing with the air circulation issues around COVID-19?
Yeah, I think that there's lots of questions about air circulation, number of air exchanges, type of filtration, and certainly I think there's some expertise out there on that. I would just say in broad general terms, any sort of movement of air, such as if you were outside versus inside in a closed space where the air is stale and not moving, that would be higher risk. Anytime you have air moving from a respiratory droplet standpoint, it's going to, move things along, and that's going to reduce risk of exposure. That would be, again, secondary to what Gina's really emphasized, because if you're keeping appropriate distance and with a mask or face covering, it's going to just start to drastically reduce that risk. We know this because, the studies that show how it limits, the exposure. So really that's your gift to others, when you do that. So, and then the movement of the air would just be secondary. And so anything that you can do to just kind of do the normal circulation of air in the classroom while you're keeping that appropriate distance is going to be great. And then any activity that can be taken outside, while the weather permits it, is always, I think, great for health, physical and mental health, to be outside. It's always a wonderful thing too. So.
Great. Is there anything else, Tamara, Gina, or Dr. Nasser, that you'd like to add? I promised you an hour. We're at an hour. Anything that you feel like we didn't talk about that has come up, out in the community that people have asked you quite often, or what else would you like to share? Dr. Nasser, we can start with you.
Just encouragement. Thank you for the opportunity. Again, we're getting ready to start to bring children back into a teaching environment. We're all very excited about that. We want to do it thoughtfully, want to do it safely. Let's stay flexible, have compassion and grace and patience with each other. It's been a very challenging time for our country, for our state, for our community. We want to try to do this in the safest way possible. And we know that it's going to be wonderful for children to get back to the learning environment safely in person. So we just want to step through these processes as we've been talking this last hour and have the agility to adjust as we need to, depending on what's happening in the community. And so appreciate the chance to be a part of the group today. Thank you.
Tamara.
Yes, I would just add, Lisa, that I know there were some questions on there that we didn't get to as far as what our routines and processes are going to be for screening kids for COVID. And so as staff have questions about that, I would just refer them to the school nurse. We have, as a part of the district pandemic plan, we have a whole health services pandemic plan that lists a lot of those procedures out. That, again, a district committee of nurses spent a lot of time developing, and a lot of thought and research went into them, as well as If staff have questions for principals, certainly they can talk to them about the building pandemic plan with some of these processes. And then the third resource that I would point staff to is if they want a list of the COVID testing resources in the Treasure Valley, they can get that from any one of the school nurses or health techs.
Oh, awesome. Thanks for all those reminders. Gina.
I would just end with assume good intent. It's hard to do sometimes, especially when we're overworked and stressed and trying to balance a number of different things. But information is changing quite drastically still, even 6 or 7 months into this. And so if you have questions, I think you can be open to asking them and understanding the reasons behind decisions and why they're being made, but know that there's just changing things happening, and they're trying to be nimble with the district level, and to do your best to accommodate your classrooms and your staff and support each other throughout this. We'll get through it together. It's gonna be tough. I don't think that to set the expectation it's gonna be easy is fair. So it's going to be hard, and it's been hard for everyone who's gone back into work and who's tried to manage the multiple things coming their way. So just try to assume that good intent as much as you're able to. And always you could reach out to the health department either through our call center, which is a really great resource to answer just a number of questions that you may have. I think that I will leave with that last plug, and that's it. Thank you.
Love it. Assume positive intentions. It's so important. I can't thank the three of you enough. Truly, I'm sure there's days that Dr. Nasser and Gina both are like, what is this question? I'll just shoot off a random question. We'll be in a meeting. I'm like, I'll just ask. And so gracious with your time and with your willingness to jump on things like this, to come to our board meetings and to do Q&As. We just appreciate you so much. And believe me, we know we could not do this without you. So again, thank you so much for your time. We're going to shift gears now, and we're going to move to the questions for the administration. So on this part of our panel, we have Superintendent Dennis, of course, is there. Debbie Donovan from the Boise Quadrant is on. Brian Walker from the Timberline Quadrant is here. Nick Smith, our Director of Human Resources. Becca Anderson, the Bora High Quadrant Director, and Terry Thamert, the Capitol High Director, are all here. And we're going to run through the questions that were asked. A lot of these questions will be definitely a lot of bleed over from the other questions. So we might be able to get through these a little bit more quickly. The first one is about, if we go live November 9th, and cases are identified in schools, will we move back to going all virtual, or if we go to category 3? And I think that Gina did a nice job of talking about that, but I can say from a district standpoint, we will watch things very slowly. This is exactly why our phased in plan is so slow. And we did have some concern expressed to us from the community about it being so slow and saying, gosh, can't we get those kids in sooner? But we really want to bring in those K2 students and watch how that works and see what we need to monitor and adjust. We want to bring in those 3-6 students and watch. And then of course the secondary. And that'll help us know if there's things we need to shift and change. That'll also help us know if we have enough substitutes to cover, if we do have, an incident where we need to quarantine staff members. But we will be very careful about moving from phase to phase, and we will work with these medical professionals and the other medical professionals when we make a decision. Our goal, of course, is to have kids doing in-person learning, but we will not sacrifice our students and staff to make that happen if it's not a wise thing to do. So, Brian, if our positive numbers for COVID-19 increase in Ada County and reach the 20% incident rate, will schools return back to virtual until they're in yellow again? So that kind of is an extension of what we were just talking about. But how would we decide if we are in virtual, then to come back?
Yeah, so in that situation, if we were in, what the question's asking is if we hit that 20% of incident rate, that would move us back to category 3 in Ada County. And would we necessarily go back to a virtual setting? And I think similar to what we heard from Gina earlier, I think in all likelihood, and there's a high percentage that we would go back to a virtual setting if we were to get back to that 20% rate. But as Gina mentioned, we would have opportunities for in-building learning. One of the things that we have to consider, and if you look at our district pandemic plan, we leave it open. In our wording, we say we may go back to a virtual setting. Part of it is we have to look at the mitigating strategies that we are putting in place and how effective those strategies are, such as our physical distancing, mask wearing, facial coverings, hand hygiene, respiratory etiquette, how well we are doing at cleaning and disinfecting our facilities. And then also a big one that we're learning a lot about is our contact tracing, of how we manage that and how effective we are at our contact tracing. So we'd need to look at all of that, and obviously with the recommendations of our health professionals too.
That's great. Thank you. I know that there's a lot around that one, and we may get back to some of that as well in our answers. I wanted to point out that one of the questions we have and is that it seems like we are going too quickly. And so I'll be honest, we have a large faction of people that think we're going too slowly, and a large percentage of people think we're going too quickly. And so within the plan that we have settled on, we're just going to have to really monitor that and adjust as we as needed. Are there resources available to provide access to COVID-19 testing for students through community resources, healthcare organizations? How do we increase confidence and safety at school by utilizing proactive and reactive testing for Boise School District students and staff?
Yeah, what I would add, I think Tamara mentioned this earlier, is that we've compiled resources of all of the testing in our community. And we have those resources at every school site where our nurses have that in hand, and they will be able to work with families, work with staff members, and give them a list of options of where they can go to get tested and what the typical, we've been able to figure out a typical turnaround time at each of the different locations because it varies from place to place. But our goal is to be as proactive as we can to provide that information when we're aware of someone that is sick or not feeling well and needs to look at different testing options.
Great, thank you. I'm going to shift to Debbie about classroom instruction, because I know as we've created this new plan, you know, we had originally really wanted to commit to 5-day-a-week learning. And then as we moved into category 3 right before school started, we realized that we needed to adjust that, especially because the building was going to look so different and getting just half the students in. So Debbie, how's it possible for teachers to teach in person and online at the same time? What are the expectations in regards to that for teachers and students?
So great question. And before I start, I want to thank everyone for the great job they have already done in virtual learning. You were able to shift into that, and we're seeing some great creative ideas and solutions for connecting with students as well as progressing them through your curriculum. So huge thank you to you guys. The intent was never to teach in person and online at the same time. We have a group of teachers in elementary and secondary that are putting together expectations and sample ideas and ways to do this blended model, to return to the phase-in model. And that may be some teachers find it successful to do a blended of doing some virtual as well as online at the same time, or in person at the same time. Others have a flipped classroom situation going. So we will provide teachers and ideas, and this will be a great opportunity for you during your collaboration time to examine what fits best for you. And that's the beautiful part about the Boise School District, is we allow teachers that flexibility to do what's best for you. So there will be, the only expectation will be that they are learning every day and that they're progressing through the curriculum.
Right. What's going to happen with attendance policies? Will they change? How will attendance be recorded if my child must stay home because they have symptoms? Can they still attend class virtually until they're able to return in person?
That's another great question. So we have not changed the policy. We've changed the practice a bit. So our procedure is that students right now are recorded as present because we're all in virtual right now. Because some of our students are not able to, for a variety of reasons, not able to attend daily Google Meets, but they are able to progress in the online material. So that will follow the same when they are in person. You will go back to your normal attendance procedure. But the question would be, if you are in person and a student has to quarantine because there was a potential exposure, the student can still progress at home using your Google Classroom assignments or Seesaw assignments. So they would be marked VL for virtual learning. So they wouldn't be marked absent, but they will still be able to progress and not miss out on the learning. So that's the other nice part about everyone using Google Classroom and or Seesaw, so that our students can continue to learn if they are quarantined.
Will there be consideration for in-service days or set contract time to allow teachers to plan, collaborate, etc., to be more prepared for the hybrid schedule?
So we know this is a stress right now, and we totally understand that. And we are encouraging the use of your PLC time to collaborate with your colleagues, and we've seen some great opportunities of that happening right now. Cross department, cross school, grade levels. It's been amazing to see that happening. So we encourage that. We also have, I believe Becca said, and she can maybe put a plug later on about there's going to be a webinar, the next 2 webinars that have been highly attended, and appreciate the integration specialists as well as Becca for coordinating those for teachers to get some of these ideas to how to do this blended learning. The calendar is set, has been negotiated, approved by the board. So changing that at this point might be difficult to do, but we are going to provide opportunities within our PLC to help with this.
And Debbie, I might add in that too, that we are very tight on hours for instruction for some of our kids too. So I know we're trying to factor all of that in as well. So there does seem to be quite a bit of differences between schools about how many days teachers are live with students. Why would that be, and what is the expectation?
So the expectation has always been that you are connecting or doing some sort of instruction each day with your students. That may have started out, some teachers may have started out with long Google Meets. As now they've been going through it, they've adjusted that to possibly a short check-in with a short instruction, followed back up with small group instruction that they're finding a little more success with. But again, we're very fortunate to have such talented teachers, and we want to allow you to use your professional judgment to see what is best and what's good for the students in the instruction, and we're seeing great results.
Okay. So this question from a staff member: teachers who have school-age children have been able to bring them to work to assist them with their online learning. What options do teachers have for that to continue on the days where their school-age children are not in person at their own school?
Yeah, that's another great question. So we are allowing for those that have brought in their children. So on the days that they are not in person, you are allowed to go ahead and continue to bring them into school. However, you'll need to be working with your principal to figure out a location for those students, because it wouldn't be appropriate for those students to be in the classroom while you're teaching. But I'm sure that there's a way to work around that, and we do want to work around that.
Great, thank you. We're going to shift to Nick, our Human Resources Director. I know we've had a lot of questions about this. We've put out a lot of documents about this, but there's still, of course, when people get into the middle of it, they have more questions. So why have you increased the hours for counselors at schools, but not nurses and health techs?
Gotta unmute. Thanks, Lisa. The best of my knowledge, we haven't increased the hours for counselors, but we have increased the number of social workers, nurses, and health techs in the district over the past few years. And maybe there's a reference there that's getting confused. So in 2018-19, we added 3 health techs, and we've also ensured that all schools have health services coverage every day for at least part of the day. We also added an additional half-time social worker in 18-19 and a full-time social worker in 2020 and 21 to try and help meet the demands and needs of our students.
And I do believe we used some of the CARES funding, as a matter of fact, to help with that, because we knew that with the students, our current state, that was going to be an issue for students. Are you hiring more janitorial staff to do all the extra work of sanitizing once students arrive?
We have been adding janitorial staff each year over the past 3 years. So in 18-19, we added 6 full-time custodians, increased the number of days for our part-time custodians. And then in 2019-20, we added 4 full-time custodians, 7 part-time custodians, and a maintenance manager. And this year for 2020-21, we've added an additional 4 custodians. Our custodians have been cleaning our buildings since March when we first had the shutdown, and they've been going through training and working on sanitizing those buildings, and they're well prepared to continue that work as we have students re-entering the facilities.
I know it's going to take a group effort and that teachers are going to be asked, in between class periods and different things to help with cleaning desks or having students help with that. And I know that we're all ready to pitch in and make that work. K2 teachers and staff members this is a question from a staff member. K2 teachers and staff members are being put at a higher risk than 3 through 12 teachers. How is this being addressed and how will they be supported?
That's a great question, and it's one of the questions that we've gotten a lot of lately is how did we come up with the idea of starting with K2 and why? A part of that answer is since the second week of school, we've had multiple small groups going in our schools. So teachers have been working with students in a variety of settings and for a variety of reasons. We also had classified employees working with students throughout the shutdown and during the summer in our Just for Kids programs. When it came to trying to make the decision about how to approach our phased reopening plan, K2 was our natural starting point since many of our K2 teachers had been reaching out to us at the district level, asking to get their kids back into the schools. There's a number of reasons that they were citing, from foundational reading skills that you just are really difficult to teach in a virtual setting, to the fact that K2 students need more support during virtual learning. And if you're a parent of a K2 student, you know what I'm talking about. And so it was a natural starting point. In regards to the support that we would provide our K2 teachers, it's the same kind of support that we would provide any of our teachers as it pertains to the personal protective equipment and the type of measures that we've put in place through our pandemic plan. Those will apply to those students to those teachers just as they would to any teacher who's working with students in a building.
Okay, thank you. I'm going to turn to Becca for this question. Becca, what if we physically don't have enough space due to the number of students in our class?
That's a good question. Can everybody hear me?
Yep.
So one thing is that we're committed to keeping the class sizes right around 25 or fewer, so that if you're splitting those classes, then you're looking at half that size when we're in our phased return. So that was one thing that we did intentionally to be thoughtful about class size. Another thing is we do really need to kind of do a kind of a physical assessment of what is in our classrooms. And so I know when I was a principal at an elementary school, we had reading nooks, you had the soft bean bags in one place for folks to do centers. A lot of our teachers are doing a really good job of kind of thinking about what can go, what areas might have encouraged kids to congregate, and getting those things out of their room. Another thing that's a tradition in primary classes is the classroom rug, where everyone gathers, and a lot of times that's where you have morning meeting, and a lot of people are rethinking whether that's going to be appropriate right now. The other thing that I've seen a couple secondary schools do that I thought was really clever is, if you have a classroom full of desks right now and you're thinking, where am I going to take these extra desks? Where are they going? Some teachers have actually used kind of the restaurant model, which is to put like a red stop sign or a piece of painter's tape on the desks where they don't want students to sit. So you're still maintaining that 6 feet of physical distance, but you're not trying to find a place to stick 10 extra desks that you might have in your classroom. And one thing that we've always said all along is we are really adamant about respecting the CDC guidelines, but the CDC guidelines have evolved, and we're going to do our best to meet those guidelines and also know what are our challenges in our buildings. So for instance, using zombie arms when kids are lining up down the halls is a lot more realistic than trying to space, a group of kindergarten kiddos down the hall 6 feet apart from one another. That's probably not logistically feasible. So using that common sense and balancing that with what we know is good practices.
Awesome. Thank you. Let's see, Brian, this is for you. So if we work with students individually in small groups, why do classroom teachers not have access to sneeze guards or those plexiglass panels for the benefit of ourselves and other students also working in the small group?
Great question, Lisa. And I would say we've spent a significant amount of time this summer talking about sneeze guards, talking about the overall effectiveness of sneeze guards. And as you heard Gina talk earlier, that there's a limited amount of effectiveness with sneeze guards. And the reality, what she shared was that regardless if you have a sneeze guard between you and another student, that if you're within that 6 feet of physical distancing, you are going to have to quarantine if one of the members of the group was to get COVID. So we've tried to limit our reliance on sneeze guards because of that issue, that they aren't highly effective overall in most settings. And what we've asked is that we want teachers and staff to think differently about their classrooms, about their workspaces, and how can they operate in different ways. For example, if I'm a teacher and I'm trying to run a small group of kids, and in the past I've always been able to bring 5 or 6 kids up to a table to meet with me during class time. Maybe we don't do 5 or 6, maybe it's 2 at a time, which you're able to maintain that physical distancing in that situation. So obviously we do have sneeze guards that we've put in place in some situations like main offices, and then also within, I know, our some of our science labs, and then also our within our special ed, our school psychs, where they're in situations where they're working one-on-one. And we will consider those on a case-by-case basis, but we have not made that part of our overall plan in every classroom.
Thank you. Why do some schools have more access to PPE, so personal protective equipment, hand sanitizer, and safety gear than other schools? Will teachers be provided with touchless thermometers and also gloves to use when needed?
Great questions. As far as PPE, the strategy that we've used in the district, again, it centers around those mitigation strategies we're putting in place. With face coverings, with hygiene, washing hands, disinfecting. Those are all the areas that we focused with our PPE. And we've provided the same amount of PPE to every school. We've made sure that we've distributed that equitably. And then also we have stored supplies at the warehouse that principals can restock for their school. And so as far as what we're providing across the district, we are keeping it uniform at at all the schools. Now, there may be situations where teachers are going off on their own and determining that they want to add their own accessories to what they're doing. But as far as what we're providing, we're keeping that the same. Thermometers, we had many discussions about the touchless thermometers this summer. And I think if you look at our district plan and see what our plan is for students and staff, what we quickly realized was it was not practical for us to be taking temperatures of every kid every person that enters our buildings from an efficiency standpoint. And so we have not made that our priority. We are providing those in our nursing offices, and then also within some select SPED programs that we have in the district. But overall, we are not making that one of our general practices. Our focus is on doing the self checks that we want our staff members and we want our families following those self-check procedures. And then we want, if someone's not feeling well, that's why we have isolation rooms in schools and where we can get to the bottom of that.
Okay, thank you. So Terry, about the students, Brian just answered a lot of these other questions that were submitted, but a teacher's asking, so if the school isn't going to do them at the beginning of the day, can they do them themselves in their classrooms?
What we have decided, to back up what Brian was discussing, is that we do want to leave the taking of the temperature to the responsibility of the nurse who is trained to do it and has the equipment as well. And so if you have a student that you're concerned about, please send them to the nurse's office, and the nurses will be able to take the temperature of those students.
So is it up to the parents not to send their student to school if they have symptoms?
We are currently in the process of getting information out to all of our students. Our principals are modifying the letter to be personalized for their school. And in that document from the school, it will talk about a flow chart that students can, or that parents can go through to help their student, help determine whether or not their student is ready for school. For example, it will say, do you believe your child has been exposed to COVID? If yes, do this. If no, do that. Do you feel your student is exhibiting symptoms? If yes, do this. If no, do that. And then if your student has a fever, what should you do? And so we will be asking parents, as we always do, to self-screen their students before they send them to school, and to not send students to school who are exhibiting fevers and other symptoms, and if they have a known exposure to COVID.
Thank you. So if a student comes to school and is found to have potential symptoms of the virus, how will they be quarantined from other students?
Tamara and our nurses and our principals have worked together to develop 2 spaces in our schools for nurses this year. One space will handle all the typical things that we do, like hand out Band-Aids, take care of those scrapes, do all the typical things that a nurse has to deal with in a school. And then another space will be designated for students who are exhibiting symptoms. In addition to that, in the communication that will go out to families, if a student experiences symptoms at school, they will be placed in that location, and we have asked that parents respond to pick up the student within 30 minutes. So we're going to try to get those students picked up as soon as we can, and then referred to their physical care, or their physician's care.
Great. So if there is a student that has symptoms or that has had to quarantine, will the other parents in the class be notified of that?
We have been working really hard, and it's one of our priorities to communicate positive COVID cases as soon as we are aware of them. So if we become aware of a positive COVID case, we will send communication out to the entire school community, not just that classroom.
And so a parent may not know if a student has a symptom if they're not positive. Is that what you're saying?
That is correct, because we need to have the confirmation that the student has COVID before we notify that there's been a COVID exposure.
Okay.
And there are other things that go around that students can be sick with that would not require us to notify families and classmates.
Okay. How will the quarantining process work for specialists, PE, music, special education, etc., who work with a portion of students from all classes? This person asking the question is concerned we will be in quarantine quite often.
We will follow the recommendations that Central District Health provides us. When we have a potential case or a positive case, we work with them to determine who needs to be quarantined. And if it does include a specialist teacher, then we will absolutely make sure that that staff member is notified, as well as any of the other individuals that need to be quarantined.
So Terry, if you have let's say you are a music teacher and you've worn your mask and you've washed your hands and you've stayed 6 feet away from the students, or if you did conference a little bit with a student, but it was less than 15 minutes, most likely they would not have to quarantine. Is that accurate?
That is correct. And that is part of the information that we would gather and share with Central District Health that would help us make that determination. But if we follow, just as you heard the health professionals talk about earlier in this session, if we follow the protocols of physical distancing, wearing our masks, frequent hand washing and hand sanitizing, and if we have brief visits with people, if there are those situations where it's 15 minutes or less, then there is very little minimal risk of exposure.
Okay. Will junior high and high school students have the option to eat outside?
Many of our junior high school plans include the opportunity for students to be able to eat outside. High schools have open campuses, and so students will also be able to eat outside if they would like to.
Great. And will we be quickly notified when we have a case of COVID-19 in our school building? And do you like the way that I'm acting like, wow, these are great answers? I do know the answers to these too as well, but
yes, of course we know. Of course, we've all worked together on this for many days. It is our goal to notify as soon as possible. In fact, our notification include the date and the time that we were notified of a positive case, so that you will be able to determine how quickly we're able to get that communication out to you.
Okay, what is the exact, and this was all capitals, plan if a student should test positive at school? Will the plan be exact and in writing and not up to discretion? This teacher wants to feel protected.
Yes. We will, like we said, if the student is showing symptoms at school, then we will be taking the proper precautions at school until the student is picked up and in the parent's care. Once we have been told that there is a positive case, then we will communicate to anyone in the school. Well, we'll communicate to the entire school community, as well as make sure that as well as make sure that anyone who needed to be identified, who needed to know that they need to now quarantine, we will follow Central District's health guidance and making sure that those people know, in addition to making sure that all people know with the letters. So sorry about stumbling on those words.
That's okay. What is the process to state a concern if we see that safeguards are not being followed by staff or students? Most staff don't feel comfortable telling other staff what to do, but then if they go to the principal, it sounds like tattling. Is there a happy medium?
I would hope that there would be a happy medium. I think one thing to keep in mind in this process is that we don't always know why someone may or may not be wearing a mask and or have a mask or a face shield, any type of face covering on. There may be a reason that they are not wearing a face covering, but I would hope that you would be able to talk with that staff member yourself. If there is something that you feel uncomfortable with, that you would be able to address it. For example, if a staff member walks into your room without a mask, you can put your mask on and say, can you please go grab your mask and come back and we can talk. If it's a persistent problem and you feel like you're not getting a solution by talking with a staff member, then please reach out to your principal to help you solve the problem.
I mean, I can speak from personal experience here at the DSC. There have been lots of times when I've seen a room might be a little bit too full and we've told people they need to move to another room. I do think we have to help each other and help kind of police each other in a nice, kind way, and making sure that we're living up to our values while we do that. But I think that it's a good thing for us to remind people. I think we simply forget sometimes. So why are students from the Boise online school being allowed back into brick and mortar in-person classes when teachers were promised this would not occur until a semester? Also, doesn't this have the potential to jeopardize in-person classes, which in turn will affect teacher and student safety?
We did have several different deadlines for enrollment in Boise Online School. And we have been very willing to work with families through this whole process, because these are times that none of us have ever experienced, lived through, have not known what to expect. And at this point in the semester, if we have a student who wants to change from brick and mortar to Boise Online School, or from Boise Online School to brick and mortar, those decisions are determined individually. All of the considerations that need to be taken in are such as, is there room in the brick and mortar classroom? Is there room in the Boise Online classroom? Is there a specific reason? For example, I had a family where one of the siblings was diagnosed with cancer 2 weeks ago. We're going to accommodate those types of situations. But it's only for extreme reasons that we will be moving students between our two systems.
Thanks. Becca, we're going to move to you because it looks like tonight you're our HVAC ventilation expert. What changes or improvements, if any, have been made to these systems and or practices? How are ventilation issues being addressed in portables and old buildings?
Okay, great question. So first of all, just to talk a little bit about some of the work that was done over the summer, we actually reallocated $2.2 million. We diverted that money from other projects. For instance, I think some of it came away from the Capitol Auditorium. Sorry, Terry and Derek. And we upgraded ventilation systems that we knew were due for an update. Also, just as a regular part of our protocol, we change air filters in all of our buildings every 3 months, no matter what. But the district is increasing our HVAC filters to MERV 11 for rolled media, which is the highest we can get for that kind of filter without burning out the actual pumps themselves. And then MERV 13 for all of our pleated filters. The MERV 13 are, I think, similar to an actual wearing of a mask. So that's what we're doing in the big systems, the air systems. And then our custodial team has been really amazing. They've done all this research. I am not a HEPA expert, but they are doing a ton of research and they're in constant conversation with HVAC experts. So that's kind of where we stand on the ventilation.
6 months ago, could you have answered a question about a MERV 11 filter?
As a matter of fact, I don't think I could have.
That didn't come from a staff member, that came from me. All right. We're going to ask Nick this question. If a staff member is asked to quarantine multiple times due to exposure at work, will there be a cap on the amount of their personal sick leave they must use?
Thanks, Lisa. Yeah, so we would not have a cap on the number of days an employee can take due to the need to quarantine. If an employee does need to quarantine, the first leave they would access would be that COVID-19 leave that was granted under the Families First Coronavirus Response Act. That would give them 10 days that they would be able to utilize. After that leave expires or is utilized, they would need to utilize their sick leave and their personal leave at that point. But again, we wouldn't cap it necessarily. If they do run out of sick leave and personal leave, there would be the potential of being able to access the sick leave banks if they are members of those banks. And if they are not a member or they have utilized the sick leave bank and no longer have access to that, then they would move into a chargeable leave status. But again, we wouldn't cap the leave necessarily.
Great, thank you. Do you expect we'll have enough subs? What's the plan if we run out of subs?
Well, having an adequate number of subs is always a challenge, even in non-COVID times. So that's a really good question. With that said, we currently have over 700 substitutes in our system that are active. And so that's a good sign, given that those subs are people who have made a conscious decision to stay a sub in our district, knowing that COVID-19 is something that we're dealing with. And so that's a positive thing. The other side of a positive aspect of this is, since we won't have many absences due to professional development and training and conferences this year, it'll allow all of our subs to focus on taking substitute jobs tied to staff illness or staff needing to quarantine, which is great. In a regular year, we usually see a large number of our substitutes going towards filling for people who are out at conferences and PD and training. So that's a positive.
Great. And my hope is that if we're all wearing masks and being careful, that we'll have less illness for other non-COVID things as well.
True.
Since some staff have been permitted to work from home while quarantined, what is being done for staff who must quarantine but whose positions do not easily translate to working from home? Custodial, food service, physical or occupational therapy, nursing, etc.
That's a great question. I've actually talked to a lot of staff about that lately, who have been calling with that type of question. And so basically what we have done is, under the guidance from the U.S. Department of Labor, under the Families First Coronavirus Response Act, employers were encouraged to practice as much flexibility as possible in working with employees who had a need to telecommute or work from home, and their jobs lent themselves to being able to do such. And while we were in a virtual setting and students were learning online, it was very much suitable to the nature of the employee's job to be able to work from home if they were quarantining. Once students return to a brick and mortar setting, it's no longer suitable to the nature of the employee's job. And so we wouldn't be able to accommodate that. And an employee who is going to have to quarantine when their students are in a brick and mortar setting, we would need them to use leave at that point. With the exception, obviously, of the Boise online school teachers, their job will still be suitable to needing to quarantine at home and be able to do their job from home. But our brick and mortar teachers, our teachers that are working in a physical school instructing kids face to face, if they have to quarantine, we would need them to take leave.
Okay. In the elementary setting, what if there is a potential exposure within a classroom? How will the quarantine process work for specialists? We have talked a little bit about this actually.
Yeah.
Actually, I think we actually answered that question. Was there anything more you wanted to add to that?
No, I think Terry covered that topic pretty well. I mean, we would follow the guidance from Central District Health and work collaboratively with them to identify who may have been exposed to the contact tracing, and that would pertain to students and staff regardless of the position. So.
One thing I was going to add to that is that we, in addition to sending the letters, we are also posting all of our COVID cases on our website. And so you can see the update in real time, because as we get one, we add it to the list.
Yeah, good point, Terry. We've really worked hard, I think, to try and be as transparent as possible with this while protecting the privacy rights of the individuals. And so we work hard to make sure that we're getting that information out to families as quickly as possible.
And Nick, I'd like to add a little bit more too in that about the privacy and confidentiality. I know we've had people reach out to us concerned because some people have been allowed to work from home, concerned about, if somebody is wearing a mask or not wearing a mask. And a lot of those issues are very confidential and very private. And so that's a good reminder too to our staff that if you know of a staff member that has contracted COVID-19 or who has a different type of a medical issue, we really need to respect everyone's privacy and not share that information. That's kind of the staff member's story to tell, and we need to be careful about the information we're sharing, especially as that pertains to students, as well. So at this point, we are 15 minutes until our targeted end time, and I think that we actually have gotten through most of our questions. Was there anything from the group of panelists that I did not get to, or that you wanted to clarify based on any other questions that came up? Okay, well, I hope we were able to answer a lot of your questions. I'm going to direct you to the website, even though I know you're probably thinking, oh my gosh, there's so much information on the website. And it's true. We have a ton of information on the website. But if you really want, it might be a nice time to go back and reread your building pandemic plan, only because when you weren't in the thick of it, you probably didn't absorb all of it. At least that's how I know I am. So if you go back and you read those plans again, you might get some clarification, and then you might have some more questions for your building principal. Also, like I said, we're going to send out all of these questions because some were very specific and individualized for a building. We're going to send them out to the principals so they can look through and see if a staff member asked a question that they can then assist you with. And please don't hesitate to reach out to your building principal with any question you have. There's going to be things we haven't thought of. And so we want to make sure that we can get to those topics for all of you. We want to be able to ease your fears as much as we can. We're really excited about students getting back in our buildings. I want to thank everybody today for listening in. So thank you. Thank you for submitting questions. And then of course, thank you to all the panelists today for being willing to answer questions. I just want to end with this, that we we have made some really tough decisions since about the second week of March. I thought we used to make tough decisions like snow days, but that's nothing now. So we've argued, we've discussed, we've vetted, we've toiled over the decisions we've made, truly to be in the best interest of students, staff, and community. And I want to implore to all of you to know that every single administrator who spoke during this second half has a family member in our schools. They range from nieces and nephews to our own children as students, our own children as teachers, and our spouses. They're at every level. They're at elementary, they're at junior high, and they're at high school. So when we make decisions, we know this will affect many people and even those in our own homes. So we truly are trying our best and trying to listen to the science and listen to the experts and listen to all of you as we make these decisions. So I just want to thank you and to let you know that there's never any desire to make it confusing or difficult for anybody. We're trying our very best to help you as much as we can. And so we appreciate your flexibility. We appreciate your hard work. And we know that together we can get through this. So thanks for tuning in today. And remember to wash your hands, stay 6 feet apart, all of that good stuff. Be well. Thanks so much.